Welcome to Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert. Today, I have trotted over to the studio with my freshly lasered co-host, Dr. Millicent Rovelo. How are you doing, Dr. Rovelo?
My face is on fire. It's literally on fire because
And it looks on fire.
And it looks like it's on fire because I thought it would be a good idea to zap my face 10 minutes before we were on air.
Why not? Why not? It's
because,
that's what you got to do.
Your day is very limited and the amount of free time you have to do things is very small. So you take that hour where you have it and come what may. Here we are.
So this is the thing. It's like people need to know that we are users of the services, that we do this.
Yes. Huge user.
That's right. So why, when people look at you and go, God, Dr. Rovelo, your skin looks so great, what do you say?
I do everything under the sun for it. Yeah.
That's right. You earn it.
I earn it because, I was telling some patient today, I'm getting a laser at the end of the day. And she's like, gosh, why? Your skin looks so good. That is why I'm doing it, because it doesn't just get that way by good genes. You know, you gotta maintain.
You do, and you have to do stuff to activate your skin. You want it to look great. And so my world-class PA of now, I think 20 years this year, Orla, did your laser at the Rock Spa, which is the part of our practice that is the Medi Spa part. So, and they also sponsor this podcast.
So thank you, Orla and the Rock Spa. She is the only person I will let touch my face. Putting that out there.
She is amazing. She has a boomer practice in Beverly Hills, and just she's so good. And it's interesting today. Like one of my patients who I did her nose years ago was in and said, and now she's like selling facials for some other company, some facial equipment and systems. She goes, the thing is that as I go around these offices in Beverly Hills and Los Angeles, and I see these people that, their staff has just gotten really strange looking over the years. Like they just get, like the longer they hang out there, the weirder looking they get.
Oh, yeah.
And I said, well, look at Orla. Doesn't that tell you something? Orla looks as beautiful as the day that, she and I met, as she was a student at Western University PA school when I met her. And that's the thing, is you really want to stay looking great. So you've got to count on somebody to not make you look weird.
And I would say that no one in our office looks weird, overdone, morphed, kind of LA zombie, puffer look.
It's true.
And if you know what I'm talking about, you know what I'm talking about. The look of someone that's just really gotten high on their own supply.
Oof.
Like it's too much. And yeah, that's why I let her touch my face.
So yeah, you did. What did you do? You did IPL.
I did an IPL, which is a photofacial for brown spots on my T-zone, because I had a few little sunspots coming up on my forehead. And then on my cheeks, I did the V-beam, and that's because I have rosacea. And so my cheeks get flushed and they get dilated capillaries on my cheeks. And so the V-beam's really good at zapping those.
Yeah, it's good for stuff that's red.
Yeah.
Well, shout out to Orla and the Rock Spa, and thank you for making this podcast anyway.
Yes.
We will move to a topic where we do not have to feature you as much on camera. How does that sound?
No breasts today. Today's all about you and what you love to do.
So today I want to talk about the tip, the nasal tip, because I think that this is something that gets lost in translation when patients come in and they say, I want my tip to be narrower, or I want it to be up or down, or I don't want to have a pig nose. And so I want to just entitle this podcast the No Pig Nose Podcast.
Oh, I thought you were going for just the tip. You blew it. That's like being handed to you.
I think we're going to have to consult with Sean on this. I'm not going to see we're doing this podcast now, so whatever it was named, I'm going to leave it up to Sean. I think he can handle it. So maybe just the tip is the title.
Because you got to get that out there.
That's got to be a keyword search, doesn't it?
I'm sure it is. And at the end of the day, we are still both 12-year-old boys. So
okay. Well, with that said, the reason I want to talk about it is that every patient that's getting some sort of reductive rhinoplasty says, I don't want to look like Michael Jackson. I don't want to have a pig nose. I don't want it to be up like this with people looking in my nostrils. They all say it because the total fear is that they're going to get a bad rhinoplasty at the tip. They think it's going to be over-rotated, that it's going to be tilted up towards the sky and look like a pig nose.
Ugh. Not cute.
So I want to address why that happens first so that people understand why they should be worried about it, and then why it doesn't happen with this guy and the people who I've trained and the strategies that we provide, because it's a very specific set of moves that gives you a great-looking tip.
All right, let's do it.
The reason that in the old days people got tip rotation that was overly aggressive, and it used to be like a 3-move rhinoplasty, and that's or maybe 4 moves. And the moves were that you would take down the hump of the nose, and this is for reductive rhinoplasty. I don't want to talk, this is not for people that need their noses built up. We've done those topics. You can reference the Hispanic rhinoplasty, Asian rhinoplasty, any of the revision rhinoplasties where we're rebuilding the nose to get how to build the nose up. This is when you're reducing a nose, and the question is, how am I not going to have a pig nose? So typically in the old days, they would take down the bridge of the nose. They would trim the cartilages at the tip. They would just literally cut them at the top part of it, which would start the rotation of the nose. They would break the bones to bring them in and narrow the bridge, and they would trim the caudal septum. And what that means is the septum is the cartilage that's between the 2 air passages, and when you push on the columella, the skin between the 2 nostrils, you're feeling the septum, the end of the septum, which is known as the caudal septum. And in medicine, we say cranial means towards the top of the head, caudal means towards the feet, towards the cauda, which is your butt. So there's down and there's up. And so what they would do is they would take cartilage off of that caudal septum, causing rotation of the tip. And when the tip would rotate, you would get a pig nose, because it would be just unchecked rotation.
And was that what was desired? I mean, clearly people knew back in the day that these moves would cause rotation. So was this a look that they were intentionally trying to create?
So, and that's the thing, is that this was in, probably the 70s and 80s, really into the 90s, and probably in some dinosaur practices around the world, they're still doing exactly that. They're doing this 3, 4, 5 move rhinoplasty that is fast, 30 minutes, 40 minutes maybe to do the whole thing. There's no structural control. You don't put in any grafts. There's nothing to it other than taking away tissue and hoping that the nose heals well. And the guys who are good at it, and guys and gals, I guess, whoever the surgeons were, they would be able to control it enough that they would get good results, probably 85% of the time, and it was fine. And their friends, the patients would send their friends, and they would have a line down the block for this very fast, easy-to-do rhinoplasty that probably left some people nasal cripples, left them unable to breathe, left them with a pig nose, and back then, there wasn't a ton you could do about it other than get to the craniofacial center and get somebody to put a big cantilevered bone graft in or something like that. So that's the old way. Today, the reason that people don't get a pig nose, especially in a structural rhinoplasty practice or somebody that's really paying attention with the way that they do these reductions, is that there's control of the rotation of the tip. And that's done through either spreader grafts, caudal septal extension grafts, grafting cartilage into the nose to control the position of the tip. And this is very important because patients don't want a pig nose.
No.
They really don't.
Yeah, I mean, some patients do want kind of the ski slope nose where you have just a hint of a little upward motion of the tip, but that's very different and much more subtle than that over-rotation pig nose.
Now, interestingly, that pig nose look has made a comeback on Instagram and TikTok. And I don't want to name the country where a lot of these noses are being done, and there's a reason for it, and so I'm going to leave the country out of it. But there's a lot of travel plastic surgery where the attraction is this quote-unquote Tinkerbell nose, and it's a very over-rotated tip with a super tip break. And the secret is that it doesn't look good in real life. It may look cool on the table, and it may look cool on Instagram.
Especially if you're wearing a little green fairy outfit.
Exactly.
Super cute.
With wings. Then it does look cute. And, the studio's right over the hill in Studio City. And, yeah, maybe Disney digs it. But it is not a good-looking nose 5 years after that operation. And I don't think that the patients know that. So why control the tip rotation? The way that I do it is through a couple of different things. First of all, I don't over-resect the caudal septum. So I don't take that cartilage away. Secondly, I take some away because I need to shorten the nose. Like yesterday, we did a nose that was, and this is what I'll do to the patients when they come in, and I'll say, how much smaller do you really want your nose? And they'll say, well, I don't know, maybe 10, 15%. And I'll be like, okay, let's think about it like this. Think about shoe sizes. Let's say your nose is a size 9 right now. Do you want to take it to a 7, a 6, or do you want to go to a 5? Because that tells them shoe sizes are like, wow, a 5 is a lot smaller than a 9. They'll go, no, I really want to go from like a 9 to a 7. Okay, I get that. And I can translate what that means. And it translates for them also.
Yeah.
But, and maybe we should come up with a nose sizing chart.
Maybe we should.
This nose is a size 14, which I've had those noses too.
Like those old school measurements, you'd put your foot in it and measure what shoe size you are. We should design one for the nose.
Totally.
You can scale it up, scale it down.
We just need to, that's kind of a cool idea, actually, the nose sizer.
The nose sizer.
But the reason that it's good to do that is that it gives me an idea of how much smaller they're thinking about it. So then, on top of that, the way that the tip gets controlled is I think about the tip as being a tetrapod having 4 legs. In the old days in 1969, a guy named Jack Anderson published an article called The Tripod Tip. And the concept was that the lateral crura were 2 legs of the tripod, and the medial crura together made the third leg of the tripod. And if you shortened any leg of the tripod or lengthened any leg of the tripod, you could get the tip to go right or left or up or down. I added to that, and I think it's useful to think of the caudal septum, the end of the septum, as the 4th leg of the tripod because it does also push the tip in space either down or allows it to rotate up. And so if you think about the tip as a tetrapod, then it makes a lot of sense that if you wanted to push it to the left, you would make the right leg longer and the left leg shorter, and vice versa. And same, you extend the tip out into space with the caudal septal extension graft or a columellar strut. And if you want to push the tip down, you lengthen it with extended spreader grafts or the septal extension graft, and you can shorten them to let the tip rotate. And by having that control and that thinking behind you, you can really put the tip in the correct position in space. And this is what creates the aesthetic look that allows the bridge and the tip to work in harmony for the beautiful looking nose. When they don't work in harmony, you can have problems.
Well, to work in harmony and also to last. So to counteract the forces that are going to happen over time, contraction, scar tissue, rotation. And by controlling those 4 different legs, as you mentioned, you have a much higher chance of really keeping that tip in the exact place that you left it.
Yeah, and it's not perfect, that's for sure, because things can happen. You can have some slippage of the caudal septal extension graft to one side or the other of the septum. It can kind of sink in onto the maxilla more than you thought if you don't have it really riveted to the upper jaw. So there's all these things that kind of come into play that cause there to be problems. But good news is when I do make a tip like this, if somebody says, boy, I really wish I had a little more projection, pretty straightforward. Little local anesthesia into the membranous septum right inside the nostril, open it up, push the septal extension graft out. 3 stitches later, you've got the projection. Oh, I think my nose is still a little too long. I'd really like a little more rotation. Great. Little local anesthesia. You can bring it back up. So the way that I set that tip in space, and same thing, with the right to left, it's also like you can lengthen one side, shorten another side. So there are these very minor moves that can be made with a tip that's constructed like this that allow a play in the system. Now, it's not often I need to do it, but it's not zero. It's probably 1 or 2 times a year on my primary rhinoplasties, and probably more like 8 to 10 times a year on my revision rhinoplasties. And so the percentages of those things kind of coming up are small, but if it's you think it's like 100%, and you're just happy that it's very easy to do, you don't have to go back to surgery, and you can get the tip in the right position with this system.
I love that. Makes it very simple, straightforward, and well, not simple because surgery is quite complicated, but it gives it a very simple way to think about it.
Yeah, and I think that's the thing for patients where they can rest assured that it's not going to be like this over-rotated pig nose disaster. In fact, if I'm guilty of anything, it's probably leaving the noses a little bit longer, just because I also am terrified of the pig nose.
It's much easier to shorten it and maybe rotate it up a little bit more than it is to try and lengthen it once it's been over-shortened or over-rotated.
Absolutely. And my percentage of revisions on primaries is very low. It's lower than the national average, so I don't even quote it. Everybody should know if they're going to surgery for rhinoplasty that there's a national average of 15% revisions. And it, depending on what source you read, some may say that it's 10%, some may say it's 20%. If it's a revision rhinoplasty, the range is even higher, from 15 to 25%, because rhinoplasty is really difficult to nail it. And what I've found is that patients who get a good result and see an opportunity for it to be better, if it's really easy, they're going to take it. Why not? If it's easy and it's going to be better, sign me up. You know, if it's like you have to go back to surgery, get a rib graft, and redo the whole thing, they're not going to do that. That's right. So that's kind of my spiel on why we're going to avoid the pig nose in primary rhinoplasty. It's just not a thing that's going to come up. It's just not cute. No, it can happen if you don't do those things, for sure. But I don't think I take that back. Actually, about a month ago, I had a pig nose come in, now that I think about it, and it was really over-rotated, and it was awful. And it was clearly just somebody took off like, way too much septum. And just, and so we need a rib graft and septal extension. So that is fixable. It's harder because, especially after an amount of time goes by, when the nose is rotated like that, the lining of the nose becomes foreshortened. And so now not only do you have to extend the cartilage, but you have to add something for the internal lining of the nose, because the scar tissue won't let it go south, basically. Yeah. It's not going to stretch out. So that's kind of my, just my rest assured, you're not going to get a pig nose as long as your surgeon's doing some structural rhinoplasty maneuvers, or even in preservation rhinoplasty, as long as they're minding the caudal septum and minding the length of the nose and where the tip needs to be in space, I think you're going to turn out just fine.
Look at the before and afters. Make sure you like it.
It's the message over and over again, isn't it?
Yeah.
All right. So any other comments from my lasered co-host?
Nope. I think you got it.
All right. Well, this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.